in the end we settled on Shiretown Community Services being the owner, but we were months sorting everything all out.
So having a Nordic spa will definitely draw a lot of people in the shoulder season, especially in the winter where the Nordic experience is super popular.
I think we're really close in St. Stephen. I was down there visiting with the team a number of months ago because we were at the point of site selection and identifying where the clinic would go.
Welcome to This Week Uncut, where we take a closer look at the top stories of the week from CHCO-TV and The Courier. I'm Vicki Hogarth.
And I'm Nathalie Sturgeon. We begin this week with the speech from the throne. So Premier Susan Holt, through the Lieutenant Governor, gave the speech to the throne, which signals a new session of the Legislative Assembly.
Always exciting for those of us who are members of the press gallery. What was your takeaway from what she had to say?
Well, certainly there wasn't a whole lot that was new in this throne speech. The title of the speech was Change in Motion. So it was laying the groundwork for a rehashing, essentially, of the promises that have already been made and sort of the progress the government is making on healthcare, education, mental health and addictions, homelessness, all of those things, and of course the economy.
And I'm sure that one thing that a lot of New Brunswickers are curious about is the budget itself. Are we balancing the budget? That was one of the big promises going into the election.
Yeah, of course. So the Liberals campaigned on a balanced budget, and you know it's funny because Premier Blaine Higgs and a lot of his success and a lot of his popularity and a lot of the reason that he was reelected a second time was his fiscal responsibility, both during the COVID-19 pandemic and the years afterwards. He, reduced the province's debt. He ran surpluses for consecutive years. And so she ran on a platform promise to balance the budget. That has not happened. The province is in a deficit situation. And her response to a question from Anna Mandan from Global News was, listen, it's going to keep going this way, but it's going to be how much we can spend without amassing a huge amount of debt. She's like, all of these changes that we're making to improve your healthcare, to improve your education are costing us money, but we want to do it in a way that it's not extraordinary, but it's going to continue for at least next year and the year after.
And of course, no one could have predicted the tariff wars that are happening around the world and with the Trump administration at the helms. But again, no one could have predicted the COVID-19 pandemic. So there was that from a previous government that did manage to do this kind of work at a very unpredictable time.
Yeah, it's a tricky situation and is the plight of every government that has ever governed in any province, anywhere, or any place, anywhere, right? You need to spend money to get programs working. You need to spend money to fund proper healthcare systems that are publicly funded. You need to spend money for public education. But at the same time, people want fiscal constraint. They want fiscal responsibility. So how do you be fiscally responsible while also, getting people primary care access, improving literacy and math scores in schools and getting more teachers in the classroom, qualified teachers in particular. So it's a tricky balance, but one that the Liberal government is going to have to get on track or defend.
What was your takeaway when it came to the entirety of the throne speech?
Yeah, so again, not a whole lot that was new there. We did learn that in the spring they're going to table legislation for a mental health advocate, which I think you spoke to Eastern Charlotte Councillor Daryl Tidd about. But that's not new. That was promised. But it does seem like there's a little bit of a timeline, an unclear timeline there. The big thing for me that I was paying attention to because of the context of Charlotte County was healthcare. St. Stephen and Blacks Harbour are both on the list for collaborative care clinics, and we know that St. Andrews is doing a tremendous amount of work to also get themselves the appropriate funding so they can be a collaborative care clinic. And so St. Stephen was mentioned, and I did ask her on Monday ahead of the throne speech, what is the status of the two clinics in Charlotte County? Where does St. Stephen stand? Where does St. Andrews stand? We'll let you take a listen to her response to my question on the collaborative care clinics in Charlotte County.
Thank you for the question, Nathalie, because I think we're really close in St. Stephen. I was down there visiting with the team a number of months ago because we were at the point of site selection and identifying where the clinic would go so that we could get some of those practitioners out of the hospital and into the kind of space they need with the additional resources they need to serve the community, and then that frees up the space in the hospital that is desperately needed for that place to work better. So I'm very optimistic that you'll be hearing positive news on the St. Stephen Clinic within this calendar year. It's one of the 10 that we committed to up front, and we're going to deliver on that. The team in St. Andrews, you're right, they're already working collaboratively. The team at the Department of Health has been working really closely with Julie and the team there as they've expanded their resources, now expanding their space and their footprint again to continue to provide those services. So we do have a good partnership in place there with the folks at the St. Andrews Clinic, and are going to continue working with them to do more and give them the tools they need to serve more of their neighbors. And then as we slide further out, there was the commitment to the folks in and around Blacks Harbour, where we have some infrastructure in place that's perfect for a clinic, and that development's going to continue, I think, to positive outcome in 2026.
That was Premier Susan Holt taking my questions on the collaborative care clinics in Charlotte County.
Now, obviously, when you make some of these big investments, it could be a lot of investment right up front, but down the line, you could see something like a collaborative care clinic. The great thing is it'll give more New Brunswickers access to a primary care provider. But on top of that, there's something to be looked at in terms of where that will bring us economically 10, 20 years down the road, when we don't necessarily need as many doctors, things like that. It could be something that is very responsible 10 years, 20 years down the road. Any feedback from the Premier when it comes to things like that? Or is there strategic thinking financially when it comes to things like this as well? I know that the primary idea is to improve healthcare for all, but there must be some economics that go into these decisions.
Sure. I mean, the idea is access to primary care. So what we know is happening based on what the Premier has said previously and what the healthcare authorities are saying is that the hospitals are overcrowded. Mm-hmm. They're overcrowded for two reasons. They're overcrowded because of the long-term care sector. So seniors who are waiting for long-term care beds either in their community or at a nursing home. And the ER is overcrowded because people are going there because they don't have primary care. And so we understand that that is a tremendous cost to the healthcare system, and not just financial costs, but human resources costs, right? We know that there's a shortage of nurses. We know that it's hard to retain nurses. We know that it's hard to retain physicians in general, nurse practitioners. Turnover is incredibly high. I'm sure we've all met someone whose doctor is gone now or has unfortunately passed away. So, as you're investing in primary care and getting people attached to the clinics, they're going to go to the hospital less. The nursing home without walls is a great example of an economic thing that is benefiting down the road. People are not going to nursing homes. They're not going to the hospital because they have places like the Charlotte County Seniors Resource Center, who is helping them find programming and find supports that help them stay in their home. So certainly the government believes that spending now will help them in the long term. It sets up New Brunswick for a healthier future. But it is hard to see that future when you don't have a doctor, you can't call for a prescription, or your kid is in a classroom with 30 other kids and the teacher's not qualified. Not that we don't value the teachers that have stepped up to help. It's just these are all symptoms of a system that's kind of just failing.
And these are things too, and I think it's important as New Brunswickers to know this isn't unique to New Brunswick. Years ago, even when I was living and working in Quebec, I remember looking at the healthcare system for how many people were going to the ER for those exact reasons, things that a family doctor, had they had one, could have taken care of. And it wasn't just looking at that idea of primary access to a primary caregiver. It was looking at how much does it cost to go in the door of an ER, and it's incredibly more expensive for the taxpayer, for people not to have access to a primary caregiver. So those are the things that I think we have to look at as the whole, as we look at the idea of, okay, investing in something might be expensive up front, but down the line, could this be saving us a lot of money as well? I know obviously human welfare matters more than that, but there are the economics to consider.
Yeah, and what's interesting is I'm going to turn quickly to St. Andrew's Council because at Monday night's meeting, so it's important to remember that the council here stepped up a while back and provided several doctors in this community the Wellness Center, which is space in the W.C. O'Neill Arena, which is something that many councils are now trying to do. They're trying to step up for healthcare providers in their community. St. Stephen is offering incentive programs. And some don't want to get involved in the brick and mortar of it, but certainly St. Andrews has. And what I found so interesting is that they've now, the health minister, Anne Susan Holt, came to visit the Wellness Center, and we have footage of that, which we're gonna show you. But Dr. Julie Levesque-Taylor did a tremendous amount of work, hiring a social worker, getting a registered nurse, finding a buddy doctor through the New Brunswick Medical Society. And so what we learned from council is that Horizon Health is actually going to pay $250,000 to $300,000 for renovations for the Wellness Center in exchange for a 5-year extension on their lease for under the terms that they have. We don't know those terms because contractual information is protected under the Local Governance Act, so that discussion will happen in a closed session, and that they've hired 3 new doctors for that clinic. Now, I'm saying this, I have a request into Horizon Health to kind of clarify who those are, when they're coming, when they start, who they are, and we'll update you next week on what that looks like. But this is a tremendous accomplishment, both for the Wellness Center, the town of St. Andrews, the council, and it is exciting for them because they've done the work, and now they've just got to sign on the dotted line.
That's it. I mean, that's something worth stressing. I think many people might remember at the end of summer, Dr. Julie Levesque-Taylor was here in the studio, sitting down for half an hour to talk about this idea coming to St. Andrews. St. Andrews wasn't one of the initial collaborative care clinics promised by the province. St. Stephen was one of the first ones that they promised to roll out. But in Dr. Levesque-Taylor's case, this is something she had done when she was a doctor back in Manitoba. So this is a model that's used in other places as well. She had tremendous success with it back in Manitoba. So she, on her own, decided, well, let's get with the program here and do this here. So it's really interesting to see that some collaborative care clinics might be under the promise of the government, while others are starting to see, hey, this is something we can get going. We don't have to be the community that, gets chosen next. We can choose ourselves.
There were, this throne speech it touched on a lot of things. It talked, one of the things that a lot of people will be interested in, maybe me more so than anyone else. But the revenue for municipalities is now delayed by another year. So they're going to have to wait until 2027 to figure out where these revenue streams come from. They've made the office of the Chief Medical Officer of Health. So that position, which was appointed by the minister, is now an independent office. Another election promise. So that legislation was tabled, and that will mean that the Chief Medical Officer of Health is, I believe, appointed by the Lieutenant Governor, and then that Chief Medical Officer of Health can then appoint its deputy medical officers of health, so the regional ones that you would have, heard about during COVID-19. She talked a lot about the export increases to Europe, India, and Hong Kong. But when she was speaking with reporters after, she talked about tough decisions are coming. So what that means, I don't know. When you think about some of the collective agreement bargaining that's going on with library workers and QP, this is the train that keeps following the Liberal government, because they campaigned on wanting to make things right, and currently it's a bit of a kerfuffle. So we'll see what happens. The throne speech didn't really give us anything new, but certainly there's legislation coming, changes are coming, change in motion.
Well, I'm very excited to head up to Fredericton with you as members of the press gallery. I'm very excited to be on the wall with you there too. We get to have our photo taken, so we will be adding 2 new women this year to the press gallery wall. So that in itself is a reason to head up to Fredericton.
And congratulations to Anna Mandan, who has been voted the president of the New Brunswick Press Gallery. We're going to take a quick break, but when we come back, we're going to discuss the changing of keys for Quinn House in St. Andrews.
It really is an all-hands-on-deck effort. We have all three levels of government working together to improve the housing situation. This is just one example, but when it comes to housing, we really do need more of everything.
Welcome back to This Week Uncut. I'm Nathalie Sturgeon.
And I'm Vicki Hogarth. We are heading over to St. Andrews for the passing of the keys at Quinn House. Very exciting times here for affordable housing for seniors.
Right. So for folks who aren't familiar with Quinn House, what is it and what did a changing of the keys actually mean?
So Quinn House was established around 1988 by the Masons, actually. This was around the time when they were thinking about seniors and life not being the way it was, let's say, generations prior, when older members of the family may have just stayed in the home as the grandparents, as the great-grandparents, or what have you. The idea behind it originally was, let's find a place for seniors that might not have the finances to live in a big house on their own. Could we make some affordable housing in the St. Andrews area, in a rural area? So it's an 8-unit apartment building in St. Andrews. That might seem small to a city, but to us, that's actually quite significant. And what the Masons felt was, over time, this was just a big part of their, the Masonic Housing and Charities Company, just a big part of their mission. And so when they found the right organization, the Shiretown Community Services, I think a lot of people in our area are quite familiar with their work. They're affiliated with the Anglican Church here, but also Helen Ann. Anyone who comes to the Friday free community lunches at the Anglican Parish Hall is well acquainted with Shiretown Community Services. There they employ people with barriers to work, help them find employment. A lot of them have gone on to become students at NBCC. Some stay there working for years and years. That's the plan. So we know the great work they already do in the community. They decided to get into housing as well, but not just any housing, affordable housing, and not just any affordable housing for seniors. Fortunately, with Quinn House, it was just the right time that they were there to take the keys on and to take on the mission that was started by the Masons.
Shout out to Augustino, who is at NBCC and does participate in the Friday Soup Kitchen. Yeah, I mean, I was listening to Linda's interview. Could you talk a little bit about how long it took to get to this point where they could take the keys over for this building?
I can, because full disclosure, I am a board member of Shiretown Community Services, not the most useful one they have. I think I've made it to maybe 2 meetings over this year. I just said, you know, it's a community initiative, a very, very important one, and I love the work they do. So when they asked me to be a part of the board, I said, probably won't make most of your meetings. They're usually around 3 p.m., but I'm here to support whatever you do. So full disclosure, I am involved in a small way, just because I appreciate the work they do, which is also why I know how long they've been working at this. It has been years. It has been a big idea that they had to. This is a big step for a small community charity group to take on. This is actually quite significant.
Did they explain why it was important to them to do this?
You know, I think it's the same way that things are important for us, telethons at Christmas, to do a telethon as well for Swallowtail Lighthouse on Graham and Inn. They're so integrated into the fabric of our community. Everyone's familiar with John Matheson, Linda Walsh as well. I think you see the work they do. It's not really just centered around the church. It's community work. It's making our community a better place. So we're seeing a lot of seniors now who are struggling to find housing. And when you look at a town like St. Andrews, we have a lot of beautiful old historic homes. Those aren't necessarily suited for someone who is up there in age, who might be on their own. Quinn House is, and I really think, you know, if this goes well, this will give them 8 units to test out managing. Who knows what that will bring in the future, but I'm very proud of this group for taking on such a huge responsibility, such a huge new channel to go down as well, and one that's dedicated to seniors, as well as I think all the residents and their friends of Quinn House. So it was quite an exciting time, I think, for everyone to see that this tradition would continue on, and also continue on in the hands of people right here in St. Andrews. I got to speak with Linda Walsh as well as John Matheson, people from the Masons, MP Williamson, a lot of interviews at the event. It was a celebration. Here's a look at some of our conversations at Quinn House.
It's a little bit surreal. It's quite exciting. We, in the beginning, didn't really even think it was remotely possible, and we persevered, and here we are today. We own the building, so it's fantastic.
Tell people who don't know how much work, how much time was involved in making this a reality.
A huge amount, because the business plan and rewriting it, and even deciding who was going to own the building, and we thought of setting up new entities, and for various reasons that was going to be a challenge. So in the end we settled on CHCO Community Services being the owner, but we were months sorting everything all out. It's quite incredible that we've actually been successful today.
For people who don't know CHCO Community Services, tell us a little bit about how that group got started, what you do, and how this has become organically a natural fit.
CHCO Community Services originally was set up by members of the parish of the Anglican parish of St. Andrews a long time ago, over 20 years ago, and it really hadn't done anything in my awareness. And then a few years ago we were chatting, and there were numerous people in the area with assorted barriers to employment. It's a challenge for them to find work, and so we started a pilot project where they created a meal one day under the guidance of a trained restaurateur, and then we sold the meals. This was near the end of the pandemic when people couldn't gather, and the pilot project worked. So then as soon as people could gather, we started actually having them come into the Anglican Parish Hall once a week, and they make 2 soups, and then they come in back in the next day and they heat it up and serve it. And we've been doing that now for several years, and it's great. Some of our trainees have gone on to full-time employment, some have gone on to post-secondary studies, and there are some for whom just going out into the workplace just isn't ever going to happen in a regular workplace. So the fact that we can provide them some care and guidance and training and make them feel like they're contributing back, and they all get paid. They love payday, so it's really good for them, and it's good for us.
How did Quinn House become a possibility? Were the Masons just ready to not keep this as one of their projects?
Yes, the Masonic Charities has other buildings. In this area, there aren't as many Masons anymore, and for the people to look after it, they just didn't have that many. And those who were here, they were ready to retire from it, so they were looking to sell the building and be able to focus on other charitable works that they do, and they do a lot of great work. So it worked out for them, and it's worked out for us.
Well, for a couple reasons. I know a lot of the people who have been involved in this project. I think it's so important for communities to work together to improve the housing situation, and that's true for people with modest incomes, whether they're young or old, but as well for families that are just getting started. We've got a real housing problem in this country, and anything that communities are doing to improve on that, I want to support. And there is a lot happening in Charlotte County. My office does work with CMHC and the federal government to try to find funding opportunities that are out there. And groups have to be organized in order to be successful and to qualify for them. And I have no doubt that the CHCO Community Services is going to be successful with the Quinn House going forward.
And what kind of supports will they be leaning on to make sure this continues to be a reality for years to come?
So there's a couple. And this is where all 3 levels of government work together. The province provides some grant money, some operation money, and then the federal government also provides money for infrastructure upgrades and things like that to ensure the roofs are solid and the homes are weathered and they're well maintained and they're comfortable for residents going forward. Yeah, no. So I was going to say, it really is an all-hands-on-deck effort. We have all 3 levels of government working together to improve the housing situation. This is just one example, but when it comes to housing, we really do need more of everything.
And then when we look at seniors as well, what are you hearing on your end in terms of the housing crisis and how it applies particularly to seniors?
Well, again, there's a lot of different elements at play. Some people, they're looking for home support like the Quinn House, where they're able to move in and live independently. Other people want to stay in their homes and they're able to do that either on their own or with some assistance. Sometimes it comes down to cost, which is a good reason to keep property taxes low so seniors can stay in their homes for as much as possible, because we don't want to price people out of their homes when they've spent so much time and they have so many memories there as well. And then, of course, there's the whole idea of people being able to buy a new home to downsize, for example. They're still independent. The home they have is too large. So we have to have those opportunities available as well, because of course those homes that people are moving out of are also opportunities for new families to come in, so our communities grow as well.
What would your message be to groups like Shiretown Community Services that want to be proactive and make a move on their own and not necessarily wait for something to happen? How should they go about navigating what's out there for resources?
Well, I think that's what's so good about the Shiretown Community Services, that they've actually had experience navigating some of the red tape and the bureaucracy, and that's where my office is here to help. I do know that when their application is in, it's going to be well done. They'll work with my office if they do have any question, and once it is in the federal government, we'll try to shepherd it through so they're able to get a response, and hopefully some funding will go along with that. Again, these programs right now, they are oversubscribed. The demand is so high. The budget is coming. I think that's going to top things up. So communities like St. Andrews and elsewhere in Charlotte County will be well positioned. But I do want to say, and this is where I think we have to look at the positive side. There's a lot to do, but I do see communities throughout Charlotte County working together to improve the situation. The federal government's got a lot more to do, but I also see programs that are working that are helping to fund home construction and support like the Quinn House to ensure they're around going forward.
And since I still have you here, we see in St. Stephen right now a 66-unit building that the town is working with, creating grant incentives and land donations to make a reality. How do municipalities step up to the plate as well when it comes to looking at housing for their community, particularly in rural settings where developers aren't necessarily inclined to look for their next project?
Yeah, well, this is where some of the programs at CMHC, Canada Mortgage and Housing Corporation, have been really helpful. That they're incentivizing builders and municipalities to work together to identify areas where buildings can go up, and then to find opportunities, and then programs are there to help with those. Again, it's not the silver bullet. This is a complex problem where all kinds of housing is needed, but we are seeing municipalities are accessing some of these programs, and they're seeing results because of it all over southwest New Brunswick.
Those were just some of the conversations CHCO had at the handing over of the keys at Quinn House in St. Andrews.
We're going to take a quick break, but when we come back, we're going to head over to the Algonquin to look at a spa that has broken ground.
Again, this is a huge economic driver for the region. It's great to see the hotel management invest, willing to invest in our community.
Welcome back to This Week Uncut. I'm Vicki Hogarth.
And I'm Nathalie Sturgeon. So my favorite part about this job is that I get to learn new things, and I get to go meet people who are doing cool things. And luckily enough, you were busy, so I got to go to the groundbreaking for USFA by the Sea. This is a Nordic spa that is being built just beside the Algonquin, and everyone is very, very excited about this new opportunity.
I was so excited, kid you not. I know I was busy. I still ran up to make the end of the event. I was half an hour late, but I ran up the hill because I was here filming a show, and it's just over there, which is going to be very convenient when I'm stressed out later. Very excited for that part.
Yes.
So I was testing out how long it takes me to get there when I sprint, and it's about a minute.
The Algonquin reached out to Geneviève Nollet, who is the founder of the USFA brand, and who owns a flagship spa in Moncton. And as I said, it's a Nordic spa focused on wellness and relaxation. So get rid of your traditional idea of a spa. Nobody's getting a manicure at USFA by the Sea. It is very common in Scandinavian countries. And what I find so fascinating about this is actually it's disproportionately men who love to use the Nordic experience. And it's more popular in the winter. Which is the key point for this project. So the Algonquin does really well in the summer, as does all of the businesses in Charlotte County, and approximately 80,000 people, according to Tourism New Brunswick, visit St. Andrews in the summer. So many people.
Feels more than that.
Right. Yeah. And Canada Day, when you're on a balcony over Water Street on Canada Day, you cannot see street. You see people. And I've learned that. And as a local, I'm kind of grateful when winter comes because there's less people here. But
that's a sign you're local.
That's right.
Yeah.
But it does mean that there is a shoulder season, right? Things start to slow down. Businesses close their doors for a little while. And, you know, the former mayor talked a lot about increasing sports tourism as part of the shoulder season, right? Wintertime activities. So this is part of that equation.
And if there are wintertime activities for me, it's going to be a spa. More likely a spa than sports. I'm not going to lie. But I do love the point that you made that these are very popular with men. And I can actually give you an example. A long time ago, 15 years. Mm-hmm. You know how I told you when I worked in Quebec? I worked for AskMen.com. It's actually an American brand that they bought from people that started in Montreal. It was a Rupert Murdoch entity. Don't judge me. But we took an annual trip when I worked at AskMen.com. I was one of about 6 women that worked there in an office of, I think we were like between 27 and 30 people. Every year we went to a Nordic spa. That was our big gathering, and it was everyone's favorite holiday. We called it Spa Day, and it was a Nordic spa. You would go from the different pools. So there's different temperature pools for anyone who hasn't experienced a Nordic spa. If you live in this area, maybe you've been to Cove, run by Dawn Dunfield, a beautiful Nordic spa just down in Quebec, where one of the cold plunges is right into the natural water, which is pretty cool experience. So a lot of times they integrate the natural world into it too, and it really is, it's more quiet. You can read a book, and it's pretty incredible. So to know that we have one here, and also that it's, you know, for locals could be something that we partake into is quite exciting. Does that explain why I ran up?
Well, yes, but if I can read books, I'm there. Doesn't matter what it is. And it's very interesting because I think that, you know, when we were talking to Alex Henderson a few episodes ago about the municipal plan, Alexander Gopin about the municipal plan, you know, we talked a little bit about how when a municipality is so focused in the tourism season, where their economy is so based in 5 or 6 months of the year, it drives up the cost of everything. Affordability becomes a lot less important. And so expanding the tourism season into the winter means more than just more people coming throughout the year. It has trickle down effects for businesses, for locals. It's a great and tremendous opportunity. Take a listen to Geneviève Nollet explaining what visitors can expect.
Unveiling this wonderful project of Spa by the Sea. It's going to be a Nordic spa opening in spring 2026, just next to the fantastic hotel that you have here in St. Andrews by the Sea. So next to the Algonquin Resort. So we're just unveiling the project. Construction has been ongoing for a couple of months now. But I mean, this is fantastic to have the community gathering together with us today and celebrate this great project.
What drew you to this project? What about it said, I would like to put a USVA by the Sea here?
Well, the idea wasn't coming from me, actually. So it's the partners that bought the hotel that reached out to me because I'm the owner of USVA Mountain. So I've been running that spa for the last 7-8 years now. So they approached me and they asked if I was interested in doing a similar project in St. Andrews. So of course, it was hard to refuse such an offer. I love St. Andrews. I come here as a tourist. Like to plan vacations around what's to do around this city. But it's mainly in the summer, to be honest. So having a Nordic spa will definitely draw a lot of people in the shoulder season, especially in the winter, where the Nordic experience is super popular.
Yeah, I mean, the community has worked really hard to develop the shoulder season, which is the winter season. How much do you think this means to them to have something like this investment here for them so that they can have a year-round tourism season?
Well, I hope that first of all, they will enjoy the facilities themselves, because wellness is for everyone. So that's one thing that I'm very proud of, is to offer a safe space where people can really relax and recharge, because we all need that these days. But community-wise, I truly believe that this is probably going to bring more business in the town. Can be on different sides when that you can look at it, but I mean restaurants, hotels, Airbnbs, like all businesses revolving around giving an experience to someone that's coming into town. I think that's what we're hoping to bring to the city.
Do you have an idea on when construction should be complete?
We're talking about spring 2026. We're hoping to stick to that schedule. We don't have control over like everything, but we believe that now we're right on schedule. So if everything goes well, spring 2026 is the time.
That's a very quick timeline.
Yes, it is. Yeah.
And so can you tell me a little bit about some of the services that people can get at a Nordic spa?
Well, the Nordic Spa, it's all about the thermal experience. So when you think about that, it's a thermal cycle that includes 3 steps: the heat, the cold, and the relaxation. So for the heat, you'll have sauna facilities. So we'll have different types of saunas. Then for the cold, we'll have a cold plunge. And for the relaxation, we'll have some outdoor pools that will be heated, of course, all year round. Many relaxation areas, and maybe some surprises along the way.
And what does a Nordic experience differ from a regular spa experience?
Well, if you think of a spa as an aesthetic kind of business, we're really not into that. Thermal experience is really about having your body relax through that thermal cycle. It's very popular in Scandinavian countries, and it's funny because in those countries it's mainly men that do the thermal experience. So it's not like a traditional spa. We won't be offering like all the nails and manicures, things like that. It's really about relaxation and focusing really on that specific service, which is the signature of USVA.
That was Geneviève Nollet, the owner of USVA by the Sea.
Wow, I feel like they couldn't pick a better location, just because if you live in St. Andrews, and I want to do some more stories on this too, not just St. Andrews, I got to give shout out to Kyle, the drifter, on Graham and Antu, who got me to cold plunge in March on the island. It's a big thing in this part of the world. There are a lot of groups just in our tiny town that go to Pendlebury Lighthouse or down at the Point to do these cold plunges. So I'm going to be learning more before the spa opens about the health benefits of cold plunging, so that I can maybe convince myself that getting into the ocean part is also worthwhile. I'll read about it. I'll let you know. But I am quite excited to have this open. And there is a lot to be said too. I remember I worked at En Route magazine, the Air Canada magazine, before they stopped printing it, sadly, this year. But we would look at things like hotels and what does it add to a town, a neighborhood, when you open up a hotel, what ends up being built around it, and how does that contribute to community? So there are other aspects that I think as we watch this come to life, we'll delve into and look at. The trickle down, like you say, has more than just the tourist experience. It really does a lot for a community to have these big additions.
And the Algonquin is the town's largest employer, and so this will mean more jobs, right? It will mean that, and it will mean that more people who work there in the summer will be able to maintain their jobs in the longer term, right? They're usually, when the season ends, things slow down. We know that. So this means more jobs, longer term jobs, right? This is good for the economy. And that's exactly what council is looking for, right? And we spoke with Councillor Steve Neal, who was in attendance, who talked about the kind of the amplification of investment by the Algonquin ownership in this community, right? They're building a new version of the O'Brien House, which is going up in record time. I mean, I looked one day and it was foundation. The next day it was an entire building. So this is important work that they're doing to make the economy in St. Andrews stronger.
I know when earlier this year I talked to Cole Sheridan, the new general manager of the Algonquin. We talked a lot about why this property was so important to the Invest Group, and a lot of that had to do with primarily primarily the golf course, but their vision for it had a lot to do with the Four Seasons. So we're going to be hearing more, I'm sure, just to see these new developments right away. I can't wait to hear what's in store. I can't wait to hear. I know Christmas committee, I'm on Christmas committee, so you know, they are doing Festival of Trees again, so they're getting very involved, but also building new additions to our community. So it'll be fun to follow, not just the spa, but what else is in store.
Take a listen to Councillor Steve Neal and what he had to say about the ongoing investment by the Algonquin Resort.
Well, again, this is a huge economic driver for the region. It's great to see the hotel management invest, willing to invest in our community. The addition of the Nordic Spa, again, their popularity, it should be a huge bonus for St. Andrews, again, to help us become that four-season destination. And again, the spin-offs I think will be great for the entire community. So,
the Algonquin is also well underway in building a new residence for senior staff as well. We're seeing that come together really quickly. What do you think it means to see new management investing so heavily, not just in tourism draws, but also making this a place to attract staff and new residents of our community?
Again, you know, it's one of the things that council has been discussing quite a bit, again, is how to expand our tourism season. Get into the shoulder seasons, become a four-season destination. So again, having that major investment from the hotel, which is basically, you know, we'll call it the anchor for St. Andrews, having them invest in their staff and again doing the upgrades to their residences is a huge bonus for the town, again, in attracting not only the tourism but also the employees that want to come and work here. So.
And as you said, council's been invested in building out the shoulder seasons of St. Andrews, known very much as a summer destination, but we are seeing it become this four-season destination more and more year after year. What is your, from council's perspective, view on how tourism has grown, especially in recent years, especially in this historic year where we saw so many Americans come over as well?
Yeah, well, again, it's been increasing year after year, as you said. The number of festivals and events taking place, again, heading into Indulge Weekend. All of these things have been expanding year after year, and again, they're just helping increase the attraction that St. Andrews is and bring more people into town through the winter, the fall, spring. So yeah, it's been a great addition to the town, and I would expect and I hope to see it continue to grow. So.
And that relationship with the Algonquin as well, the transition seems to have gone well with council and the Algonquin. Tell us a little bit about that relationship and how you've built it up in such quick time.
Yeah, the new management group, again, they've been working with council, again, on these two major projects, but again, they've been very, very energetic, we'll call it, very eager, and I mean, they've been great to work with. They've come with tons of ideas on how they can, again, help improve the experience here and help develop the town. So, yeah, it's been great working with them so far.
That was Councillor Steve Neal speaking about the importance of a new spa being built at the Algonquin Resort. So the key piece of information is, when is this going to be ready? And Geneviève told me at the announcement that they expect it to be completed by the spring of 2026. Wow. Very fast timeline. But she said, there are many things that are out of my control. So she said things could change. So the target is spring of 2026. Who knows? Okay, well, I'm ready. I'm ready now. We are going to take a quick break, but when we come back, we will look ahead at next week.
Is the most linked to belief norms.
Welcome back to This Week Uncut. I'm Nathalie Sturgeon.
And I'm Vicki Hogarth. You have a busy week next week. What's in store?
I'm always busy. I'm never not busy. We will be working on a few stories that have, carried over from this week. We did a lot of more local content. I'm going to be looking at a story about what I mentioned in the first segment, which is that the revenue streams for municipalities have been delayed yet again. This has been a promise of successive governments, and it keeps getting kicked down the road. So this will mean extraordinarily that municipalities are going to have to start looking at raising rates, or they're going to have to look at starting to cut services. And nobody is going to be happy about either of those things, because on top of it, there is a property assessment freeze. And I don't think we've been given any indication that that may change in 2026. Wow. So we'll see where that is. And I'm working on some stuff related to Eastern Charlotte. I'm not going to tell you what, but I'm working on some stuff for Eastern Charlotte. So look for that information.
Very exciting, very exciting. I know I was away this week, so we are really catching up in real time on this show right now, which I love that we could do that. I literally came in the door from being on Prince Edward Island, and the lights were set up, and here we are. So I am excited to really unpack the week ahead. Really 2 days. It was 2 days in Charlottetown, but an exciting 2 days. I know I've been texting you the whole time and sending photos. Patrick and I went to putting the local back in local news symposium, second ever one put on by the Missioner Awards and the Rito Hall Foundation. So it's a really big deal for CHCO and the Courier to be not only invited this year, but we were at the first one too.
And I've said this to everyone who's ever asked me about this situation. The Missioner Award is the highest award a journalist or a journalistic organization can receive in the country of Canada.
Yes.
It's very important. We're all nerds. We all love it. This is a big deal.
So, I mean, not that we won a Missioner Award. We were invited.
We went to the,
We were invited to not only hear from our colleagues across the country about what's working in terms of keeping local news just surviving but thriving. We were there because they see us as an example of a place that's really working. And nothing touches your heart more than that when you are in a corner of the world like we are, when a scrum with a politician can look like this. It's probably just the two of us. So to be around people from across the country, and not just other journalists, there were some incredible journalists there from independent publications across the country. We were the only TV, there's very little TV left, right? That's independent. So, I mean, we are the sad reality of what's now happening in the print industry, where you see just drying up these local, independent, to me, the most important ones that exist. I actually think most people would say that too. This is where news happens on the ground, in communities, about the people. Everything we do is about you. So it was neat to meet other people doing the same. Shout out to my friend Ollie Williams at Cabin Radio in Yellowknife. He is one of my, from this conference this year and last year, one of my favorite journalists working in local news, because he just gets it. Well, if you see me running around in a Cabin Radio sweatshirt, a cool hoodie, that's because he gave it to me, and I absolutely love it. But you learn so much from each other, and it was nice to be an organization that other people learned from too. And we found these incredible collaborators, and we were in a room for 2 days with just some of my biggest heroes too. So I'm a little overwhelmed. I need to unpack it more. It was just really, really unbelievable to know that we not only are inspiring to others, but also we have the support of our entire community across the country. Some pretty big policymakers too, as well as people like Ed Greenspan, who was the editor-in-chief of the Globe and Mail for years. He's also the head of Public Policy Forum. So just so neat, so neat.
Journalism is hard work. It is exhausting, but we love it. And we do it because we believe in it, and we believe in the power of local journalism. And every night I'm here, every Tuesday I'm here for TV Bingo, because without the generous contributions of the community, by buying our cards, by showing up to our telethons, by participating, by volunteering, by running cameras, by helping us, you're keeping journalism alive, and that is the most important thing that you can do.
And this is the last point I'm going to make about this. There's so many more. I'll probably talk about it next week too. But I could not believe, well, first of all, I got to brag about our incredible team, not just Nathalie and Florence, Patrick as well, he was there, but our volunteers that we have from, from people that are kids and high school students too, all the way up to people in their 80s, seniors from our community, and how they all make this work. But also, what was neat, because we think sometimes there's this idea that the TV bingo, for us, we know how important it is, but it was neat to see that resonate with everyone else, because one of the things we talked a lot about was sustainability and avenues to finance local news, because it is hard to sell advertising, especially in rural areas, that could really allow you enough money, you can't really ask a lot of small businesses, especially in underserved provinces like New Brunswick. How do we make this work? One thing we talked about was the idea that the government should be, not advertising on Facebook the same way and putting their money where their mouth is and supporting local news. I know that some provinces have looked at giving 25% of advertising to local news. But people looked at bingo as this real success story of our community supporting local news. $7 a week, buy a card, and they said we entertain them on top of that. We're not just asking for handouts. We put on a show, and all of you support your own local news. So Southwest New Brunswick, actually no, we shouldn't say that because you play across New Brunswick. New Brunswick, from the bottom of my heart, thank you for playing bingo, and not just because you play bingo, but because you support local news, you support independent local news. You've made us who we are, and your support means everything. It really does.
And I'll give you some food for thought because, we often get the old adage, the pesky reporter. They're here again. But think about what this community would be like without local media.
And on that note, we look forward to seeing you again next week. I'm Vicki Hogarth.
And I'm Nathalie Sturgeon.